Did you know that your vaginal discharge can reveal a lot about your health? It's something we often overlook, but it's a crucial aspect of our well-being. Today we're shedding some light on this often misunderstood topic. We'll be exploring the different types of vaginal discharge and what they could potentially indicate about your health. It's an important conversation to have, as it can help us understand our bodies better. So, without any further ado, let's delve into the world of vaginal health. To begin, it's important to understand what vaginal discharge is. At its core, vaginal discharge is a completely natural and normal part of the menstrual cycle. It's a fluid that's produced by the glands inside the vagina and cervix, which carries away dead cells and bacteria. This process helps keep the vagina clean and healthy, preventing infections and maintaining a normal pH balance. Vaginal discharge isn't a static thing. It changes throughout the menstrual cycle. It can range from clear and watery to a more creamy texture, and these variations are completely normal. At the start of your cycle, immediately after your period, you might notice that there's not much discharge at all. This is because the hormone estrogen, which stimulates the production of discharge, is at its lowest level. As your cycle progresses, estrogen levels rise, and so does the amount of discharge. Around the time of ovulation, which is usually about halfway through your cycle, discharge can become clear and stretchy, similar to the consistency of egg whites. This is a sign that you're in your fertile window. After ovulation, discharge usually becomes creamier and may appear white or yellowish. This is due to the increase of the hormone progesterone, which prepares your body for potential pregnancy. It's also worth noting that hormonal changes aren't the only things that can affect the amount and consistency of your discharge. Sexual arousal, stress, diet, and exercise can all play a role as well. Understanding these natural variations is crucial because it helps you recognize when something might be off. If your discharge suddenly changes in color, consistency, or volume, or if it's accompanied by other symptoms like itching or burning, it could be a sign of an infection or other health issue. Now that we've established what normal discharge looks like, let's discuss when you might need to be concerned. Not all changes in discharge are cause for concern, but some can be a sign of an underlying health issue. The world of vaginal discharge can be a bit confusing, so let's break it down. First, let's talk about changes in color. It's normal for discharge to range from clear to milky white. However, if it turns yellow or green or appears bloody outside of your menstrual cycle, this could be a sign of trouble. Yellow or green discharge can be a symptom of a bacterial infection, such as trichomoniasis. Bloody or brown discharge, on the other hand, could signal anything from a harmless breakthrough bleed to a more serious condition like cervical or endometrial cancer. Next, let's consider smell. Healthy discharge typically has a mild, musky odor due to the presence of bacteria. But if you notice a strong, foul or fishy smell, it could be indicative of an infection. Bacterial vaginosis, a common bacterial imbalance, often comes with a fishy odor. Trichomoniasis, a sexually transmitted infection, can also bring about a foul-smelling discharge. Now, on to consistency. Normal discharge can vary from thick and sticky to thin and watery depending on where you are in your menstrual cycle. But if it becomes chunky or frothy, it's time to take note. A chunky, cottage cheese-like texture can signal a yeast infection, while a frothy discharge can be a symptom of trichomoniasis. Finally, let's discuss associated symptoms. Often changes in discharge come with other symptoms like itching, burning, or discomfort during sex. These symptoms could point towards an infection such as a yeast infection or bacterial vaginosis. However, some conditions like sexually transmitted infections or certain cancers may not present with any symptoms at all. Changes in discharge can also be linked to hormonal changes. For instance, during ovulation, pregnancy, or menopause, you may notice changes in the volume and consistency of your discharge due to fluctuations in estrogen levels. Recognizing these signs is the first step, but it's equally important to remember that many conditions can cause similar symptoms. For example, both yeast infections and bacterial vaginosis can cause itching and changes in discharge, but they require different treatments. So, it's crucial to seek medical advice if you notice any changes. In the case of diseases such as cervical or endometrial cancer, early detection is key. These conditions can cause changes in discharge, but they may also present with more serious symptoms such as pelvic pain, unexplained weight loss, or abnormal bleeding. If you experience any of these symptoms, it's crucial to see a doctor immediately. Understanding these signs can help you identify when something may be off with your health. It's essential to listen to your body and take note of any changes, no matter how small they may seem. By staying informed and proactive, you can ensure that you're doing everything you can to protect your health. While not all changes in discharge require medical attention, it's crucial to know when to seek professional help. Let's talk about some of the signs that might warrant a visit to your doctor. It's essential to understand that your body has a unique rhythm, and occasional variations in vaginal discharge are normal. But what you should watch out for are persistent changes that don't go away after a couple of menstrual cycles. If you notice an unusual color, like green or gray, or if the discharge has an extraordinarily strong odor, it's time to pick up the phone and make an appointment. These changes could indicate an infection or another health issue. Now let's discuss the accompanying symptoms that should make you sit up and take notice. These symptoms are your body's way of signaling that something is amiss. If you're experiencing itching, burning, or pain in your vaginal area, it's a clear sign that something's not right. Discomfort during urination or sexual intercourse is another key indicator. If you find yourself constantly feeling uncomfortable or experiencing pain in these situations, it's essential not to ignore these signs. They could signify an underlying condition like a yeast infection or bacterial vaginosis, which require treatment. Remember, your health is in your hands. It's easy to dismiss these symptoms as minor annoyances or hope that they'll go away on their own. But it's far better to seek help early on than to wait until the problem has escalated. In some cases, abnormal discharge can also be a sign of more serious conditions, like sexually transmitted infections or even cervical cancer. Therefore, it's essential not to take any chances and consult a healthcare professional as soon as possible if you notice any of the signs we've discussed. Remember, when in doubt, it's always better to consult a healthcare professional. Your health is the most valuable asset you have, so never hesitate to seek help and advice if you're concerned about changes in your body. Regular checkups and maintaining good hygiene practices play a crucial role in vaginal health. Let's consider this for a moment. Our bodies are constantly changing, evolving and reacting to the world around us. And just like how we go for regular dental cleanups or annual physicals, it's equally important to schedule regular gynecological checkups. Why, you might ask? Well, these checkups are not just about finding problems. They're about building a relationship with your healthcare provider, understanding your body better, and staying proactive about your health. They're like your body's own personal state-of-the-art security system, alerting you to potential issues before they become bigger concerns. But that's not all. A healthy lifestyle can also contribute significantly to vaginal health. Eating a balanced diet, staying hydrated, exercising regularly, and getting enough sleep can all help maintain a healthy balance in your body, including your vagina. And let's not forget about the importance of good hygiene practices. Now, this doesn't mean using all sorts of fancy perfume products. In fact, it's just the opposite. The vagina is self-cleaning, and using such products can disrupt its natural balance. Instead, focus on keeping the external area clean and dry, wearing breathable underwear, and changing sanitary products regularly. Remember, each one of us is unique, and so is our health journey. What works for one person may not work for another. But the key is to keep learning, keep exploring, and keep taking care of your body. Taking care of your health is an investment that always pays off. To summarize, your vaginal discharge can be a vital sign of your health condition. It's a natural part of your body's functioning, and changes in its color, texture, or smell can signal different things. Clear or white discharge is typically normal, while yellow, green, or foul-smelling discharge may indicate an infection or other health issue. Recognizing these signs is crucial, but it's equally important to know when to seek professional advice. If you notice persistent changes in your discharge that you're unsure about, it's always a good idea to consult a healthcare provider. They can help you understand what's happening and provide necessary treatment if needed. Finally, let's not forget the importance of regular checkups and maintaining good hygiene. These practices can help prevent health issues and ensure your body is functioning at its best. So, as we wrap up, remember this key takeaway. Paying attention to your health is the first step towards a healthy and happy life.